I am taking an important topic in pharmacokinetics. That is, as in this module, we will be dealing with the pharmacokinetics of continuous intravenous infusion in one compartment model. Under the session pharmacokinetics in the course biopharmaceutics and pharmacokinetics. So let's see what we are going to discuss today and our learning objectives. So first one is we will be understanding the basics of drug administration by continuous IV infusion. And then we will be able to differentiate drug administration by IV infusion and IV bolus administration. Then we'll be able to draw a continuous IV infusion model in one compartment model and to derive the various pharmacokinetic equations. To construct the plasma drug concentration profile and its phases, and finally to calculate the important meaningful pharmacokinetic parameters. So first we'll move into the basics of drug administration by IV infusion. As we know, there are some drugs whose concentration need to be stable and to be maintained in blood for their effective drug therapy. And as this picture indicates, that is there is a administration of a drug through a bedside patient through a infusion set assisted by a nurse, as this picture you can see. So continuous IV infusion refers to the continuous administration of a drug for a long period of time through vein, more than the half-life period of a drug, elimination half-life specifically. And in the IV infusion, the drug is administered at a predetermined rate that is called as rate of infusion. So there is an important terminology that is called rate of infusion. What is rate of infusion? Is the administration of a drug at a predetermined speed. The speed is determined. Then through IV infusion, we can give a larger amount of drug at a slower rate. When administered at a slow rate, a large amount of drug can be given. The another advantage is that reduces the fluctuation in the blood drug concentration. That is, the blood concentration is maintained between a minimum value and a maximum level always. And the other advantage is that through this route, that is continuous IV infusion, certain drugs, apart from drugs, certain nutrients such as glucose, electrolytes can be provided. So that is the biggest advantage. Now, one similar such route is IV bolus, and we can compare and differentiate these two routes. Let's take some characters like the duration of input. In IV bolus injection, it is short, and for IV bolus infusion, it is longer. And the very small dose is only permitted in IV bolus injection, whereas in larger doses can be given through IV infusion. And the other important difference is that the rate of input, rate of input follows first order in IV bolus injection, whereas in the case of IV infusion, it follows a zero order. So that is a basic difference. And the external control is somewhat possible for continuous IV infusion. Now, representing this model, we have this picture. You can see, okay, so the drug is given externally to blood and other tissues, is considered as one compartment. And the rate of input process is indicated by R0, as this picture indicates, and the rate of elimination is defined by KEX. That is, Ke is the rate of excretion, and X is the amount of drug present in blood. And Ke is the first order elimination process. Okay, so this is the general representation, how you can represent a model. So we have discussed the basics and the model and the difference between IV bolus and IV infusion. Now let's review some of the questions. So try to answer these questions. So what does continuous IV infusion of a drug means? It means the drug is administered at a predetermined rate over a long period of time through vein. And can you give some advantages of IV, continuous IV infusion? So there are a number of advantages. The first advantage is that the rate of input can be controlled. Okay. And it for a more long period of time, that is for effective therapy, there should be a minimum effective concentration in blood, that is not between the not above maximum concentration and below minimum effective concentration, so that can be achieved. The another important question is what are the additional benefit through this route? So there is a important benefit is that certain co-administration of drugs such as nutrients, electrolytes can be given through the same route. And the important factor regarding the IV infusion is that what is the order of rate of infusion in continuous IV? It is a zero order. That is, it is at a predetermined rate. That is why it is called a constant infusion. Now, moving to the derivation part, we will be deriving some pharmacokinetic equations. As we all know, we will start with the uh, rate of change of amount of drug in blood, that is given by the equation. General equation is dx by dt is equal to the difference. Yes, what is the? It is the difference between the rate of input and rate of output. Rate of input and rate of output. So as you know, rate of input is indicated by R0, that is a zero order, and rate of elimination is first order, which is indicated by KEX. So we have the equation dx by dt is equal to R0 minus KEX. Now into the integration and rearrangement in terms result in terms of amount of drug in blood, that is X. So we have this equation, that is X is equal to this is X is equal to R0 divided by KE into 1 minus e raised to minus KET. What this stand for? It is a mono exponent term with the elimination rate constant. This is elimination exponent. And converting into drug concentration term, already we have C is equal to X by VD, that is amount of drug divided by VD. So here we have C is equal to R0 by KEVD into 1 minus e raised to minus KET. And what is already you have studied what is clearance is? Clearance is the parameter which is depend upon both KE and VD. So you can replace this KE VD in terms of total body clearance as you can see CLT. Okay, so we have equation into C is equal to concentration of drug following IV infusion. C is equal to R0 by CLT into 1 minus e raised to minus KET. So we have studied the various equations or equation to describe the plasma drug concentration. Now we will see the plasma drug concentration profile and its phases following continuous IV infusion. As this picture you can see, it is having this graph is plotted between time and concentration on y-axis. So which is differentiated by 3 stages. So as the starting, the rate of infusion will be 0. And as the process of infusion start, the blood plasma concentration slowly increases exponentially, constantly to reach a steady state, that is indicated by CSS. Subscript is there, CSS, you not. Okay. Then after this stage, what happens is it will be followed by a decline that is due to the elimination process, which is sometimes referred to as post-infusion phase or elimination phase. And at this stage, that is at a CSS, that is steady state concentration, the rate of input will be equal the rate of output. You remember this, that is the rate of input will be equal to rate of output. That is rate of elimination will be equal rate of output. So far we have discussed the various equations and the phases of plasma drug concentration profile. Now we will see the important pharmacokinetic parameters and their calculation, how they are calculated. So mostly there are three main important pharmacokinetic parameters following continuous IV infusion. The first parameter is CSS. What is the CSS? CSS is steady state concentration. So as already I was told in the previous slide, isn't it? What we have told at a steady state, what happens? The rate of infusion will be equal the rate of output. Okay. So we can modify the rate of change of amount of drug, that is in the previous equation, dx by dt will be equal to 0. So we can equate R0 minus Kex will be equal to 0. So R0, that is rate of infusion, will be equal to Ke into XSS. What is this XSS? XSS stands for, in terms of XSS, it will be equal to R0 by Ke, and XSS is the concentration steady state, amount steady state, and converting in terms of steady state concentration, we have R0 divided by Ke into Vd. So we can say that CSS is equal to R0 by total body clearance, CLT. Or you can say that steady state concentration will be equal to the rate of infusion, R0 divided by clearance. The third parameter is, second parameter is elimination rate constant Ke. So already we have the previous equation. What is the previous equation? CSS is equal to R0 by CLT. So substituting this value in equation 4, that is a previous equation, right? You can see this previous equation now. So that you convert what you will get is C is equal to, in terms of C, you will get CSS into 1 minus e raised to minus KET. You take it as equation 7, and a rearrangement of this equation, you will get CSS minus C divided by CSS is equal to e raised to minus KET. What is the equation? CSS minus C divided by CSS is equal to e raised to minus KET. That is another equation, equation number 8. Now taking logarithm on both sides, as we all know, log of CSS minus C by CSS taken together will be equal to minus KET by 2.303. Since e raised to minus KET is e raised to log E is 0. Hence we have that term minus KET by 2.303. And now we come to the conclusion that log of CSS minus C by CSS is equal to minus KET by 2.303. So when you plot a graph on a semi-logarithmic graph with this value on y-axis and a time on x-axis, that will yield a straight line with a declining phase, as this picture indicates, with the slope value will be equal to Ke by 2.303. Let us assume the slope of this graph we draw is 0.5. Then Ke can be calculated. Ke can be calculated by Ke is equal to slope into 2.303. That is approximately 0.5 into 2.3 is equal to 1.15. And the unit is hour inverse, isn't it? Okay. Then the another important parameter is loading dose. Loading dose, have you seen this term, loading dose? Loading dose is indicated by X, and that is indicated by XOL. So what this XOL indicates? XOL indicates the loading dose. So already we know that CSS, what is the aim of IV infusion? Continuous IV infusion. The aim of continuous IV infusion is to reach steady state. So in most of the drug therapy, almost 95% of the CSS to be reached for effectiveness, for effectiveness, therapeutic effectiveness of the drug. But in real cases, what we can see that some certain drugs that is having long elimination half-life will require almost it usually it requires 5 times the half-life of a drug to reach 95% of the CSS. But in this long having drug having long half-life, what happens is it will takes even a long period, even days, to reach the steady state. So that will result a failure in the therapeutic effectiveness or a subtherapeutic uh, um, uh, cases. So in such cases, what we will do is we have to administer a large dose, a large continuous IV bolus dose. You note this, it is a IV bolus dose, not oral dose. So is given initially in order to achieve the percentage CSS rapidly. It won't take as much days. Okay. And then to maintain this CSS, you have to infuse continuous intravenous infusion. Okay. So what is this? Loading dose will be loading dose um, is a large IV bolus dose that is given to achieve the steady state quickly in some cases. So that equation is given by loading dose is equal to loading dose is equal to uh, uh, CSS divided by VD, where CSS is a steady state concentration and VD is volume of distribution. So that today we are concluding this. So these are our learning objectives. So let's see what are we have learned through this module. So upon completion of this module, we are able to understand the different characteristics of drug administration by continuous IV infusion, to compare and contrast the IV infusion from IV bolus dose, and to illustrate the pharmacokinetic model with the key process and the parameters, then to derive and recollect different pharmacokinetic equations, calculate the plasma drug concentration following a continuous IV infusion, to construct a plasma drug concentration profile following single dose IV infusion, and to explain the pharmacokinetic parameters such as steady state concentration and loading dose, and finally to predict the therapeutic outcome of a drug following continuous IV infusion in kinetics. So, dear students, for further reading, you can refer this textbook. That is a textbook of biopharmaceutics and pharmacokinetics, textbook of applied pharmaceutics and pharmacokinetics by Leon Shargel, and biopharmaceutics and pharmacokinetics, a practical guide for teacher support.